attract more U.S. nurses, nurse practitioners, physicians, and allied health professionals to our province to help strengthen our healthcare system. I would now like to invite Premier Eby to share the good news.
Good morning, everybody. Nice to see you, and thank you to Women Children's Hospital here for hosting us this morning. We do, in fact, have some very good news to share with British Columbians today. It was about just over a year, just short of a year ago. We looked around at what was happening in the world and thought that there was an advantage potentially to be had by reaching out to American healthcare professionals and letting them know what the opportunities were for them in British Columbia. British Columbians will know one of our big challenges in the healthcare system has been recruiting the number of healthcare professionals we need, whether they're doctors or nurses or health science professionals, to be able to deliver the level of service that British Columbians deserve. So we thought to ourselves, look, we'll reach out and we'll underline our advantages. Obviously, British Columbia is a great place to live, one of the best places to live in the world. A very high standard of living, a great place to grow your career as a medical professional, a place where we respect reproductive rights, where we respect science, it informs our policy, and we have a universal healthcare system where you don't have to pull out your credit card to access care or put your family into debt for the rest of their lives to ensure that you get the care that you need. So we brought that message south of the border. Now, you'll remember at the time the Conservatives were very opposed to this. They thought it was a waste of money. They thought it wouldn't be successful. They were very critical of the program. Well, I'm happy to share with you that our hunch was right. We have been able to recruit a significant number of American healthcare professionals, and I'm here to provide you with an update on that. In the 10 months between March of last year and January 2026, more than 400 healthcare professionals have accepted job offers within BC's public healthcare system. That includes 89 doctors, 260 nurses, 42 nurse practitioners, and 23 allied health professionals. Some are here already, like Dr. West, who will be speaking briefly, working in communities throughout the province, and more are on their way. It's great news for British Columbians. It means more doctors, nurses, and health science professionals to support you and your family getting the care you need. These health professionals are distributed across the province, across health authorities. It means hundreds of additional highly skilled health professionals that we would not have otherwise had access to. Now, I know Minister Osborne will be giving you more details about this announcement, but I just want to say to any American healthcare professionals that are out there, British Columbia is ready to welcome you with open arms. We have a public healthcare system. We respect science. We respect reproductive rights. We have highly inclusive and welcoming workplaces and communities, and we can't wait to welcome you to British Columbia. Come join your friends. Thanks very much.
Thank you so much, Premier. Making the decision to move to a new community is never easy, but it is even a bigger step when it's to a new country. The doctors, nurses, nurse practitioners, and allied health care professionals who are choosing to come to British Columbia, they're not just changing jobs. They are moving families, they're starting new chapters, they're building new lives. And we knew that we had to make that as smooth as possible. So we brought together what we're calling a Team BC approach, working closely with regulatory colleges, with Health Match BC and health authorities to streamline credential recognition and to help U.S. health care professionals find and apply the jobs that they're seeking quickly. We are already seeing the results, as the Premier has outlined, and last year we received more than 2,750 job applications from U.S.-trained doctors, nurses, nurse practitioners, and allied health professionals who want to work here in British Columbia. We've already registered more than 1,300 to be able to work here in British Columbia, and that includes over 930 nurses, over 200 nurse practitioners, more than 200 physicians, and that in itself includes more than 70 family doctors. And these are professionals who are moving from the US from places like Washington, Oregon, California, Texas, New York, Colorado, Alaska. They're choosing communities all over British Columbia, including Vancouver, Victoria, Nanaimo, Port Alberni, Kelowna, Terrace, Nakusp. A few months ago, I had a chance to meet 3 emergency room nurses who have moved to Nanaimo, and hearing their stories and about why they chose to come to British Columbia, how excited they are to start their careers here, build their lives here, really brings home what this recruitment effort is all about. These are healthcare professionals who are making BC their home. They're strengthening healthcare teams here. They're helping communities across our province access the care that people need. And it is just the beginning. We continue to see strong interest from US doctors, nurses, nurse practitioners, allied health professionals, people who want to come here to British Columbia. And when people ask why, the answer is very clear. British Columbia is a place where professionals can practice evidence-based medicine in a strong public healthcare system. It's a province where we protect access to reproductive health care. It's a province where people receive care based on their needs and not on their ability to pay. But it's also about the quality of life here. BC offers universal health care, free public education from kindergarten to grade 12, subsidized childcare, world-class universities, and safe, diverse communities. For many health professionals and for their families, these are very powerful reasons to choose British Columbia. And as Premier Eby said, some of these professionals are already here, strengthening our healthcare system today, and many more are on their way. And we're really proud to welcome them, because every single doctor, nurse practitioner, and allied health professional who chooses to move to British Columbia is making our healthcare system stronger for British Columbians. So I'd like now to invite Dr. Yanto West to come up and make a few remarks. Thank you.
Thanks, everyone. So I started graduate school in Seattle in 2014, and a couple of years in, I had the idea that I might want to move to Canada. So I booked my credentials with something called the National Register. That meant that when November 2024 came around and our family made the decision to move to Canada, the process went a little bit smoother. We were able to move pretty fast. It was still a lot of things to do, but it reduced the paperwork burden, and I was able to make things happen pretty quickly. We took it just one step at a time. A former colleague from Vancouver actually gave me a Zoom tour over Google Maps of Vancouver, and that helped me feel like, okay, we can do this. Things like Health Match BC and Todd Maffin's videos gave me hope to keep going. I was able to get registered as a psychologist in BC in about 6 months. And then I had a job offer in about a month. And about a month after that, we were moving. We had to leave a lot behind in order to move so quickly. Our car paid off, but it couldn't convert to kilometers, so the car had to stay. But that said, I'm really loving my bike commute. As my coworkers will attest to, I talk about it every day. The neighborhood has been so welcoming. I've never had such a neighborly daily life before. We were just talking about, I have cup of sugar friends, where I can walk down the street, borrow a cup of sugar, pick each other's kids up from the pool. Like, I've never had that kind of a neighborhood before. And I had no idea about the ice rinks. There are so many. I'm working at BC Children's, and I'm loving it. The people here are amazing. I love all the diverse disciplines and the way research is valued here. I'm very grateful to be here.
Thank you so much, Dr. West. On behalf of everybody, I want to say thank you for following your heart to British Columbia, helping to take care of our children and youth here at BC Children's Hospital. We really appreciate all of the passion and the expertise that Dr. West is bringing, and hoping that they'll reach back out into their communities back home and invite even more American professionals to move to British Columbia. So with that, we will conclude this part of today's event, and I would like to invite Premier Eby back up for questions. Thank you.
Thank you, Minister, and thank you everyone for joining us here today at BC Children's Hospital. We're going to take questions from the media now.
Just before we get into questions, I just wanted to briefly address concerns that people feel about the atmospheric river events that are taking place along the northwest coast, central coast, and potentially the west coast of Vancouver Island. We'll have an update later today about those weather events. The River Monitoring Centre is keeping track of river levels across the province, and we will keep British Columbians updated as we move forward and get more information about any flood risks in those regions. Thanks very much.
Thank you, Premier. We're going to take questions from the press now. All reporters will have one question and one follow-up. For media on the line, please remember to press *1 to enter the queue and to unmute yourself when called upon. We're going to start here in person with Ben Mildred from CTV.
Thanks very much. My first question is from my colleagues on Vancouver Island, and it's for Minister Osborne regarding the announcement today.
Okay, go ahead.
I just want to give you time to adjust your podium.
Okay, yeah, we'll get it done. Appreciate that.
Nanaimo has received a lot of coverage for being a hotspot for U.S. healthcare workers. Can you talk about the impact on the island, and are you able to break down the numbers at all for how many U.S. healthcare professionals have chosen to settle on the island?
Sure.
Give it a chance to come down.
Thank you so much for the question. We're really excited to see U.S.-trained professionals making the move to all different communities, different size communities in British Columbia. We have had some really strong interest on Vancouver Island. And in fact, out of the 414 healthcare professionals that have accepted job offers in the last 10 months, 97 of them have come to the Island Health area. And some Nanaimo, but also Port Alberni, Tofino, Victoria, other communities on Vancouver Island. They are settling well, and as I said in my remarks, just listening to some of the stories, for example, of ER nurses that have made the move to Nanaimo, and they are feeling safe, welcomed, really enjoying a workplace setting with their colleagues, and mostly speak about a real values match with our public universal healthcare system here in British Columbia, and being able to practice medicine, deliver healthcare in the way that they were trained to, that they were called to as professionals, and being able to do that safely here in British Columbia.
Follow-up, Ben?
Yes, thanks. My follow-up is for Premier Eby. It's off topic. World events have caused the price at the pump to spike dramatically in recent weeks, adding to the cost of living burden that many British Columbia families are dealing with. Does your government have any plans, whether that be through a targeted rebate or perhaps an easing of some of the gas taxes to make things easier for BC families?
Thanks. I know it was a point of concern for many British Columbians, myself included, when the price at the pump skyrocketed in relation to events in the Middle East. Knowing that our crude stock is coming from Alberta, refineries in Alberta, and in the United States, and the refinery in the Lower Mainland, as well as a smaller one up north, trying to find that connection between events in the Middle East and the price at the pump for British Columbians has been a concern. The Utilities Commission has been given the authorities that they require to be able to ensure that British Columbians are not being gouged at the pump for events that are taking place internationally but have very little impact on domestic feedstock for the pumps. And we will be looking to the Utilities Commission to fulfill that responsibility for British Columbians. We will always be looking for ways to ensure affordability for British Columbians. This is a very challenging issue given global events and our continued advocacy for consideration around additional refinery capacity for Canada so that we're able to withstand and ensure that we have a safe and secure supply of gasoline, jet fuel, and other essentials for our economy. Going forward, given the instability globally, is a suggestion that we hope the federal government takes seriously.
Next, we'll head to Katie DeRosa from CBC.
Has put out a report into the rebuilding of the community of Lytton. And it found that at the time of the fire, the province did not have a comprehensive legal framework to guide disaster recovery, and also that the province didn't anticipate that they expected the village to do its own recovery, and many residents did not have fire insurance. So I guess what did the province learn from this report, and what will be done to improve going forward?
Thanks. The report will be out later this afternoon, and the minister will be responding to the report on behalf of government. The situation in British Columbia has changed since the fire in Lytton. We passed a new law that requires the conversations between communities and First Nations to happen in advance of an emergency rather than in the middle of an emergency or immediately following an emergency. This hopefully will be just one of the many improvements that have come about, hard lessons learned through the events and the terrible loss of property that took place in Lytton following that devastating fire. We look forward to responding to the Auditor General's report when it's released this afternoon.
Follow-up, Katie?
Yeah, this is from a colleague in the Seashells area. The federal government says that temporary foreign workers can get an extension, but it requires a positive request from the province. So will you be writing this letter for workers on the Sunshine Coast?
Yeah, thanks, Katie, and thanks for asking me about this. You know, first of all, we have many communities that have labor shortages in different areas, and including in the area of today's announcement, healthcare. I am not a fan of the temporary foreign worker program. It ties workers to a single employer, raising the possibility of abuse and exploitation. It does not provide a pathway to citizenship. So workers who have built a life in a community, are contributing, are paying taxes, are filling a vital role, are facing deportation back to home countries, including in critical areas like healthcare, childcare, and in the private sector as well. The idea that the solution to the challenges we face is an expansion of this program is frankly a bit frustrating. We have advocated to the federal government on multiple occasions that the provincial government of British Columbia deserves the same opportunity as the provincial government of Quebec to direct permanent, long-term citizenship path labor opportunities, that we can recruit those workers that we need for our province and offer them a path to citizenship so that they can stay here and work here and build our province as people have for generations. I don't understand why that call hasn't been heard. In fact, our numbers of permanent places that we can offer people a path to citizenship through the provincial nominee program has been cut dramatically instead of expanded. This is a point of agreement across the province or across the country, provincial leaders nationally, that this change needs to happen. Today's announcement about the overwhelming interest of healthcare professionals to come to British Columbia from the United States is just one sector. Similar overwhelming interest exists in academia, in the private sector, leading researchers, business operators, others who would love to come to British Columbia, people to fill vital roles in rural and northern communities, for businesses to be able to operate, everything from restaurants to educational facilities, to childcare facilities, to highly skilled trades. We need to have that ability to offer a pathway to permanent citizenship and recruit those workers that we need. I do not believe that this announcement by the federal government assists us at all in addressing those needs for the long term. It will bring in a group of people that will face deportation again in 2 more years when their licenses expire. How does that help us? How does that help us build a province that we need? We will continue to advocate to the federal government for reforms to ensure that rural and northern communities have the support that they need, that we're able to recruit the workers that we need, that we're able to build on this amazing healthcare work that we've done, bringing healthcare workers not just from the United States, but also from the United Kingdom and around the world to British Columbia. And we really need the federal government to listen and to understand that that is the best way to help us build this amazing province that we live in.
Andrea McPherson, Global News.
Good morning. This question is for Health Minister Jody Osborne. You've talked about the number of doctors, nurses relocated, recruited to BC over the last year. Can you clarify how many healthcare workers have left BC over the same time frame and where they ended up going?
Thank you for the question. Yes, so today we're announcing that 414 healthcare workers have moved from the U.S. to British Columbia and accepted job offers, with hundreds and hundreds more applying for jobs and expected to be on their way. We don't have specific statistics on healthcare workers who leave British Columbia, but we can look at the registry of physicians and nurses, for example, and know that over the past year we have added, for example, 3,300 nurses to British Columbia. We have as well added more physicians into British Columbia who are traveling here from other provinces, from other countries as well. So the net effect is very positive. That's more people moving here than leaving the country. In fact, we lead the country in terms of the number of physicians per capita, something we're very proud of, and we're going to continue to do by training more physicians, nurses, and healthcare workers who will stay here in British Columbia, as well as making it easier for those healthcare professionals coming from other provinces and other countries to be part of our healthcare system here. Thanks for the question.
Follow-up, Andrea?
Just regards to the security incident at the Abbotsford Hospital yesterday with the call of the person with the gun, are you looking at metal detectors or increased security at hospitals and healthcare settings in BC because of this?
Thank you for the question. Yesterday's incident is very serious. We take these incidents very seriously. Every worker, every patient has the right to feel safe and be secure in BC's healthcare facilities. That's why we work closely with the health authorities, and we work closely, for example, with the BC Nurses Union to do the work of having relational security officers, for example, who work directly with clinical teams in hospitals. There is a voluntary weapons screening program at St. Paul's Hospital that shows promising results, and we're in further discussions with the Nurses Union around other strategies that we can deploy, again, to make sure that people are safe and that they can get the health care that they need.
Next, we'll head to Mark Page, the Black Press. Go ahead, Mark.
Yes, thank you for the question. It sounds like the regional district, there's a question for the Premier, by the way. It sounds like the regional district of the East Kootenays is planning to align with the rest of BC on Pacific time, and there's a chance that Golden might do the same thing. So the question for the Premier is, have you spoken to local officials about this? Do you want all of BC to be on the same time zone? And do you have any idea of what the plans are in the Northeast?
Yeah, thanks for the question. One of the big advantages of British Columbia staying on permanent daylight savings time is that it aligns us with a significant portion of the Northeast that was already on that time zone in our province, as well as parts of the Kootenays, including Castlegar, for example, that were already on that time zone. It's really good news to hear that remaining portion of the Kootenays are looking at staying on permanent daylight savings time as well. Having a unified time zone across the province will be an advantage for all British Columbians. And we've also seen some hopeful indications out of the United States. U.S. Senator indicating that she is going to renew her advocacy for a bill to pass through Congress to allow Western states to align with British Columbia. And hopeful news out of Alberta from the Premier of Alberta that they are now looking at staying on permanent daylight savings time as well. We're hopeful that we're able to kick something off here and ensure that people, not just in British Columbia, but across the West Coast and into Alberta, get to experience the benefits of staying on a single time zone.
And Mark, do you have a follow-up for the Premier?
Yes, this is on a different topic. I've already asked this question to the Forest Minister, but I wanted to ask the Premier about it because I think it's an important issue for many people. 5 members of the Old Growth Technical Advisory Panel sent the Premier a letter saying, with some scathing observations, including that old growth deferrals are not being honored and that some areas are already being logged. And they want the province to take responsibility for managing deferrals and instead of downloading harvesting decisions to First Nations, and in some instances to one single First Nation. Now, my question for you is, will BC listen to these recommendations and take over the management of deferrals?
Well, the issue of forestry and forest management is a crucial one for the province of British Columbia. We are no longer in a position as a province where we can continue to liquidate old-growth forests in order to sustain the forest sector. We need to transition it into a sustainable, long-term, renewable industry. Other places around the world have done that, and we are doing that as well as a province. This is through everything from the manufacturing jobs program, where we're getting more value per tree, creating more jobs per tree in this province by adding value before logs are exported, and also bringing forward a proposal for a working forest. This is a designated area where additional permits are not required, where the forest is working continuously to be able to provide stability to the forest sector in terms of fiber supply. This is a long-term project. Part of the work is with First Nations. Legally, under the Constitution, we are obligated to respect First Nation wishes in relation to First Nation territories where they have rights and title. So we work with First Nations, we come up with shared priorities, and work to deliver benefits that actually lift up the whole community. That's what we see in North Vancouver Island with the Nanawakolas Forest Treaty. This is a very complicated but crucial agreement between First Nations, local communities, forest companies, all working together to preserve crucial areas of shared importance, to provide a sustainable forest sector going forward, and to ensure that all boats are lifted. This is hard but important land use planning work, and we will continue to do that work. All voices are welcome at the table, but the core here is a sustainable forest industry going forward that will be able to support communities for the long term.
Next, we'll head to Wolfgang Deppner with the Canadian Press.
Yeah, hi, good morning. Thank you for taking my question. Question regarding the number of or the recruitment of American healthcare workers. Previously, obviously, you talked about the advantages of BC when it comes to various issues. But what about some of the disadvantages of working in the healthcare system in British Columbia? How transparent is your government when it comes to outlining some of the issues around working hours, some of the safety issues? We talked about this already. And I was also hoping that Dr. West might be able to weigh in on that question as well. Thank you.
Yeah, sure, Wolf. Thanks for the question. One of the things we encourage American healthcare professionals to do, and we wherever we can, we facilitate it, is to engage with BC healthcare workers to be able to understand what the realities are of the jobs in different parts of the province. We don't want people to come here and be surprised and then pack up and turn around and go home. We want them to come and build a long-term life here. I think it's really important to recognize that the challenges that are in BC's healthcare system are not unique to British Columbia. They are North America-wide. Shortages of healthcare professionals, people with serious mental health and addiction issues accessing treatment and needing to access treatment, but sometimes presenting serious safety challenges. Making sure that we're able to provide sustainable care to an aging population. Making sure that the infrastructure that we have is keeping up, and that we're able to incorporate research and cutting-edge treatments that are increasingly expensive. And through a universal public healthcare system, particularly challenging to be able to accommodate in a financially sustainable way. These are not unique challenges to British Columbia. These are challenges that are all over the place right now. Healthcare workers know that. And we want them to come up, eyes open, to the challenges that we face here in BC, but also to understand the huge advantages that we offer compared with many American healthcare environments. You don't have to worry about the patient that you're treating going into debt for the rest of their lives, declaring bankruptcy because of medical bills based on orders that you have made. You are able to make the right medical decision for the patient without consideration for the patient going into debt for the rest of their lives or having a patient turn down treatment that they need. You are able to come here and know that you have a government that recognizes the value of vaccines that are scientifically tested and proven to be effective, that we advocate for strong public health measures, that when you have a patient that needs birth control or requires other access to basic reproductive rights that people should be able to access without any barriers, that you will be able to facilitate that access without thinking, oh, is this a state that allows this to take place? We are an open and welcome jurisdiction. We are not a jurisdiction that is free of challenges, but there is no jurisdiction right now that is free of challenges in healthcare. And we need that open-eyed arrival to British Columbia so that people stay here for the long term. I'll invite Dr. West if Dr. West has some comments.
Yeah, I think this answer is going to make more sense to my American colleagues. I don't know if I can explain how much of a difference it is to sit with a patient, create a treatment plan, and not have to think about how insurance is going to impact their care. That used to take up so much of our time, so much of our thinking, so much of our triaging. And I know that that doesn't quite make sense here. This is only kind of going to make sense to my American peers. And it didn't even make sense to me. Someone could tell me about this, but it wasn't until being here and working here for several months before it started to kind of sink in. Even the way that I think about how I chart was so impacted by the fights I had to do with insurance. So I think all I can say is there a transition? Yes. Are there things that are different? Yes. It took me about a month to start typing behavior with a U in it. So there is a transition, but difficulties, it's not that dissimilar for me as changing from one clinic to another. Patients are patients, but not having to worry about insurance, not having to worry about is someone going to not use an ambulance or not come to the ER because they're afraid of the cost. Like, to have that lifted off my mental burden is such a relief that I think you have to experience before you really understand it.
And Wolf, do you have a follow-up, sir?
Yes, I do. Thank you. Thank you for that answer. Question on an unrelated matter, namely TRIPA. To the premier, you said at the beginning, you said late last year, and as well later on earlier this year, that the government would bring forward amendments to TRIPA. The legislature is currently not sitting. And the time on the legislative session is running out a little bit here. We're about halfway through. And when can the public expect to see these amendments to DRIPA? And if they're coming later on the session, why wait on such significant changes until late in the legislative term? Thank you.
Yeah, thanks, Wolf. This is important work that we're doing that comes about as a result of a significant court decision that is currently also under appeal. This is not a schedule that we are enthusiastic about, but it is one that we are forced into, and we are prepared to engage with that. It means that we are trying our best to work with chiefs across the province to be able to find a path forward to address the province's concerns about the court decision, while keeping it intact what the chiefs are hopeful to see in terms of the Declaration Act going forward. It is not simple work. It is under a very truncated timeline of necessity, and we're hopeful to find that path forward. We look forward to introducing any proposed amendments as quickly as possible, and we're trying to do so in partnership with First Nations leadership across the province, because those relationships are important, not just at a sort of person-to-person level, but at an economic level for the province. There is not a single major project of the $50 billion in projects that are reaching final investment decision in the next 12 months that don't require strong partnerships with First Nations. We have $4 billion in mine announcements, new mines opening in the province in the last 4 months. All of those mines have strong agreements and partnerships with First Nations. If we want to move quickly, if we want to grow the economy, we need strong relationships and partnerships with First Nations in this province. It is legally required by the Constitution, but it is also a huge benefit to those project proponents in terms of providing stability and certainty. So trying to balance all these different factors, being able to grow the economy, provide jobs and opportunity, preserve relationship with First Nations, respond to this court judgment, is not something that happens overnight. We're working closely with our partners in finding a path forward.
And that concludes today's event. Thank you very much.